Hello, and welcome to the School-Based Healthcare Services Training, Billing for Speech-Language Therapy Services. This training is intended for speech-language therapy providers who participate in the School-Based Healthcare Services program. In this training, we will take a look at which providers can participate in the SBHS program, which students are eligible to bill for, covered and non-covered services, how to bill for and document your services, and how to provide and bill for telemedicine services. Please note that a PDF of this training with active hyperlinks is available on the SBHS webpage at www.hca.wa.gov/SBHS. SBHS Program Overview. The School-Based Healthcare Services, or SBHS program, is an optional Medicaid program which provides reimbursement to contracted school districts, ESDs, charter, and tribal schools for providing medically necessary health-related services to Medicaid-eligible students who receive special education services per an IEP or an IFSP. This program allows school districts to receive reimbursement for services that they are already federally required to provide per the Individuals with Disabilities in Education Act. The SBHS program does not cover all of a school district's costs for providing special education and related services, but it can help supplement the district's budget. School districts can use their Medicaid funding to hire additional staff, purchase assistive technology, or pay for professional development. It is up to each district how they spend their Medicaid dollars. The SBHS program is administered by the Healthcare Authority, or HCA. HCA is the state Medicaid agency in Washington, and it is also the agency that manages the health benefits for state and school employees. The main contact for the SBHS program is the SBHS program manager. Any questions about the program should be directed to your district's SBHS coordinator or directly to HCA's SBHS program manager. Many parents and/or schools worry that if their school district participates in the SBHS program, this will somehow affect services that students may receive outside of the school. Please note that receiving services through the SBHS program will not affect services that students receive outside of school. Eligible speech-language therapy providers. The following individuals are eligible to participate in the SBHS program: Department of Health licensed speech-language pathologists, DOH certified speech-language pathology assistants, interim permit holders, and non-licensed school staff. Services provided by SLPAs, interim permit holders, and non-licensed school staff must be provided under the direction of a Department of Health licensed SLP per their scope of practice with DOH and OSPI. The requirements on this slide apply to DOH licensed SLPs, SLPAs, and interim permit holders. In order to participate in the SBHS program, these individuals must hold active and unrestricted licensure or certification with the Washington State Department of Health, must have a National Provider Identifier, or NPI, from the federal government, and must be enrolled as a servicing provider under the school district's Provider One account. As stated on the previous slide, SLPAs and interim permit holders must be supervised by a Department of Health licensed SLP per their scope of practice with DOH. Provider One is Washington State's electronic Medicaid billing system. If you are a licensed SLP, SLPA, or interim permit holder, your district's SBHS Medicaid coordinator will need to collect information from you, such as your DOH license number, your date of birth, Social Security number, NPI, etc., in order to enroll you as a servicing provider under the district's Provider One account. Billable services that you provide are then entered as claims by either the district's SBHS coordinator or a third-party biller. Although you are enrolled as a provider in Provider One, you will not need access to the Provider One system, as you will document your services elsewhere. We will take a look at the documentation piece a little bit later on in this training. Non-licensed school staff providing services under the supervision of a licensed provider do not need to be enrolled in Provider 1. Any services provided by non-licensed school staff are billed under the supervising provider's NPI in Provider 1. Supervision requirements for speech-language therapy services can be found on DOH's website, as well as in DOH RCW 18.35 and DOH Chapter 246-828 WAC. Supervision requirements can also be found on OSPI's website for school-based providers. In addition to Department of Health and OSPI supervision requirements, Medicaid requires that supervising providers review and sign off on any treatment notes kept by SLPAs, interim permit holders, and non-licensed school staff. Eligible students. In order for a school district to receive reimbursement through the SBHS program, a student must have an IEP or IFSP with related services. The student must have active Medicaid coverage, and the district must have received parental or guardian consent prior to billing for services. Please note that school providers are not required to determine eligibility information. You should receive a list of eligible students from your district's SBHS Medicaid coordinator, or this information should be loaded into the documentation software provided by the district's third-party biller. If you are not sure if you should submit claims for a certain student, please contact your district's Medicaid coordinator. Typically, special education and related services are provided in the school setting. However, the SBHS program also provides reimbursement for services provided in the natural setting and in an alternate setting in accordance with the Individuals with Disabilities Education Act. If services are provided in a setting other than the school, providers must document this in their treatment notes so that the correct place of service can be entered in the claim in Provider 1. The SBHS program also reimburses for services provided through audiovisual and audio-only telemedicine platforms. Covered and non-covered services. The SBHS program provides reimbursement for IEP or IFSP evaluations and re-evaluations, as well as for the direct IEP or IFSP services, such as audiology, mental health, nursing, occupational, physical, and speech-language therapy services. As a school-based provider, you are often multitasking and doing many things in addition to service delivery. There may be additional activities that speech-language therapy providers provide on a daily basis. However, Medicaid will only pay for direct health-related services provided directly to the client. Services such as attending IEP meetings, observation of a student, parent consultation, reviewing records are not Medicaid billable services. Many of these activities are already built into the rates assigned to each direct service code. It's very important to remember that when you are documenting the time spent with each student, you are only documenting the time spent providing direct services, as that is what is Medicaid reimbursable. Federal regulations state that speech-language therapy services must be ordered or prescribed by a licensed physician or other licensed healthcare providers within the provider's scope of practice. This means that for the SBHS program, licensed SLPs may evaluate, diagnose, and provide services without a script from a physician within their scope of practice as outlined in the Department of Health WAC 246-828. There may be situations when an SLP needs to refer a student to an outside physician, or a student may require a script from an outside physician. SLPs should review the Department of Health regulations pertinent to their provider type to ensure they are referring and providing services per their scope of practice. Medicaid does not pay for speech services prescribed or recommended by non-licensed speech therapists, SLPAs, or SLP interim permit holders. In addition, Medicaid does not pay for speech services prescribed or recommended by a provider if it is not within their scope of practice. Billing for services. As mentioned on a previous slide, one of the activities that SLPs can bill for are evaluations or re-evaluations, which are done as part of the IEP or IFSP process. SLPs may only bill for evaluations if the evaluation results in an IEP that includes speech-language therapy services. For example, if you are asked to evaluate a student to determine if he or she requires speech services and you determine the student does not require services, even if an IEP is written, you would not be able to bill for this evaluation. If, however, you perform an evaluation and it is determined that the student does require speech-language therapy services in the IEP, you would then be able to bill for the evaluation. If additional tests and services are provided as part of the evaluation, the SLP may bill for these additional tests and services using the appropriate codes, which we will review a little bit later on in this training. Just a reminder that the only providers who can bill for evaluations and re-evaluations are Department of Health licensed SLPs. In order to be reimbursable through the SBHS program, speech-language therapy services must be included in the IEP or IFSP as either a special education, related, or consult services. The IEP and IFSP must state the frequency of services required and who will be providing the services. If a speech service is listed as a consult service, these services are only reimbursable when the provider is providing services directly to the student. Consult services provided to another staff member or parent is not reimbursable. The SBHS program will not reimburse for services provided in excess of what is written in the IEP or IFSP. For example, if the IEP states the student requires services 2 times a week, but the student actually receives services 3 times a week, the provider may only bill for 2 sessions since that is what is written in the IEP. However, makeup sessions may be reimbursable when the provider clearly documents in the treatment notes that the session is a makeup. When providing services as part of group therapy, the provider can bill for the direct time spent with each student. In addition, when 2 or more providers provide services to the same student on the same day, both providers can bill for the direct time spent with the student. Providers must clearly document when services were provided as part of co-therapy or group therapy, and providers must only bill for the time spent providing services to each student. In order to record what services you provide, the SBHS program utilizes current procedural terminology, or CPT codes. If you've worked in a hospital or clinic setting, you know that all medical procedures have a corresponding procedure code. There are literally thousands of codes available, but the SBHS program utilizes about 20 SLP codes, which are listed in the SBHS billing guide. Providers should ensure they have access to the current SBHS billing guide at all times in order to ensure they are using the most appropriate codes for the services they are providing. The SBHS billing guide, along with the SBHS fee schedule, can be found on the SBHS webpage. Providers must use their professional judgment when determining the most appropriate codes to use for the service provided. The SBHS Program Manager can provide guidance on SBHS policies and procedures, but cannot inform providers which codes to use. Speech-language pathologists working in a school setting are considered medical professionals, and these providers must use their professional judgment. Speech-language providers may seek guidance from the American Speech-Language Hearing Association or a current procedural terminology manual to review appropriate use of speech therapy codes. Some speech-language Therapy services are billable when provided via telemedicine, as can be seen on this slide. More information about how to provide and bill for speech teletherapy can be found in the telemedicine section of the SBHS program billing guide. All CPT codes are either timed or untimed. When providing services, providers should be aware of whether a code is timed or untimed to ensure they are documenting and billing appropriately. For timed codes, each measure of time as defined by the code description equals 1 unit. For example, code 92607 is timed per 60 minutes, which means that 1 unit equals 60 minutes. Untimed codes are billed as 1 unit no matter how long the procedure takes. Please note that most SLP codes are untimed. So how can you tell if a code is timed or untimed? Sometimes time will be listed in the short or long description of the code, but not always. Because the SBHS billing guide only publishes the short description of each code, a column to the right of each code indicates whether a code is timed or untimed. If the code is a timed code, the measure of time has been included, as you can see here for code 92607 and 92608. If the code is untimed, the comments column will be left blank, which means the code can only be billed once per day, per provider, per student. As you can see on this slide, the last 4 codes on this page are untimed as the comments column is left blank. As mentioned previously, most speech-language therapy codes are untimed, which means the codes are not based on the actual amount of time spent providing the service. For example, if a provider is providing speech therapy using untimed code 92508, no matter if the procedure takes 30 minutes or 60 minutes, the provider will only bill for 1 unit of this code per day per student. If a provider attempts to bill for more than the allowable maximum units per day, the claim will deny, and the school district will need to resubmit the claim with the appropriate number of units submitted. Please note that even when providing services which are untimed, providers must still record time in and time out on treatment notes and service logs. The SBHS program follows the National Correct Coding Initiative, or NCCI policy. The NCCI policy was created by the Centers for Medicare and Medicaid Services in order to promote national correct coding methods. NCCI assists the HCA and the SBHS program to control improper coding that may lead to improper payment. The NCCI policy has 2 edits. Procedure to procedure, or PTP edits, prevent improper payments when incorrect code combinations are billed for the same client on the same day by the same provider. For example, code 92507 and 92508 cannot be billed together on the same day when provided by the same provider to the same student. Medically unlikely edits, or MUEs, are the maximum unit of service a code can be billed for the same client on the same day by the same provider. For example, providers can only bill 1 unit of code 92508 per day per student per provider. If claims are submitted that violate the NCCI policy, claims will deny. In order to avoid claim denials, providers are encouraged to view the CMS NCCI website to ensure they are billing and documenting properly. If you've worked in a hospital or clinic setting, you know that in addition to procedure codes, each procedure also requires a diagnosis code in order for insurance to pay. The SBHS program utilizes one diagnosis code, R69, which stands for Illness Unspecified. As a provider participating in the SBHS program, you don't really need to worry about this, as this information is entered on the claim in Provider 1 by either the district's Medicaid coordinator or the district's third-party biller. You do not need to record the diagnosis code on your treatment notes. However, I just wanted to provide this information as a reference. Your school district may have additional time limits for when treatment notes are due. However, Medicaid's time limit for SBHS providers to submit claims are outlined on this slide. Providers must submit the initial claim to Healthcare Authority within 365 calendar days from the date of service. Within 24 months of the date of service, a provider may resubmit, modify, or adjust an initial claim that was assigned a transaction control number. Claim submission is typically done by your district's Medicaid coordinator or your district's third-party biller. Documentation requirements. When participating in the SBHS program, providers must follow Medicaid documentation requirements, which requires providers to keep detailed treatment notes that justify all billed claims. Treatment notes may be kept in electronic or handwritten format. Treatment notes must be maintained for 6 years from the date of service. Treatment notes must contain the following information: the student's name, the student's date of birth, student's Medicaid Provider 1 ID, the date of service, and for each date of service, the time in and time out, the procedure code, a description of the service provided, child's progress to each service, and a note whether the service was individual or group therapy. Notes must be authenticated by the provider who performed the services with either a handwritten or electronic signature. So what does this look like in practice? Some school districts contract with an outside billing agent or a third-party biller who will assist the district with submitting Medicaid claims. If your school district contracts with a billing agent, you will keep treatment notes in whatever software the billing agent uses. Some examples of documentation software include EasyTrack, Whammer, or Embrace IEP. As mentioned previously, supervising providers must review and co-sign any treatment notes kept by SLPAs, interim permit holders, or non-licensed school staff. This can be easily done within the electronic documentation software provided by the third-party biller. After the treatment notes are reviewed and signed, the third-party biller then uploads the information as a billable claim into the Provider 1 system. The process is similar if your school district self-bills. With self-billing school districts, it is recommended that each provider within the district keep their treatment notes in a template, either handwritten or electronic, to ensure Medicaid documentation requirements are met and to ensure that the person who is entering the information into the Provider 1 system has all relevant information. Resources. If you are a speech-language therapy provider participating in the SBHS program, there are multiple resources available to you on the SBHS webpage. It is recommended that providers bookmark or save this page as a favorite. Resources for speech-language therapy providers can be found under the Resources section and then under the Service Providers subsection. Under the Service Providers subsection, there are 3 columns titled SBHS Billing Information and Fee Schedules, Trainings and Webinars, and Additional Resources. Under the Billing Information column, providers will find a link to the SBHS Billing Guide and SBHS Fee Schedule. Under the Trainings and Webinars column, providers will find the PDF and recording of today's training, as well as other trainings such as SBHS 101. Under the Additional Resources column, providers will find a link to the NPI registry, as well as to the Department of Health. At the very bottom of the web page, providers can view past SBHS Gov delivery notifications, as well as sign up to receive SBHS Gov deliveries. SBHS program contact information can also be found at the bottom of the web page. One resource available on the SBHS webpage is the SBHS Billing Guide. The SBHS Billing Guide is essentially the program manual for the SBHS program. The billing guide is intended to be used by school district administrators, SBHS Medicaid coordinators, as well as providers who participate in the program. The billing guide details how to bill correctly for SBHS services, including current billable codes, documentation requirements, how to bill for telemedicine, etc. The guide also lists SBHS covered services, non-covered services, information on program monitoring, eligible provider types, eligible students, etc. In most cases, answers to frequently asked questions can be found in the SBHS Billing Guide. A link to the current and past versions of the guide is available on the SBHS webpage. Providers may print out a copy of the guide. However, it is recommended the guide instead be accessed and viewed electronically. This ensures the provider is viewing the most recent version. In addition, there are active hyperlinks throughout the guide, which can only be accessed if viewing electronically. The SBHS program sends out email notifications via Gov Delivery. Providers are encouraged to sign up to receive SBHS notifications to ensure they are kept up to date on program updates and changes. Providers can sign up to receive SBHS Gov Delivery notifications by visiting the SBHS webpage and clicking on Sign Up for Email Notifications found at the bottom of the webpage. Providers may also view past program notifications by clicking on View Past Program Notifications. Please note that if you are trying to view past notifications on Google Chrome or Microsoft Edge, you will need to install an RSS feed extension in order to view the notifications. Directions on how to do so can also be found at the bottom of the webpage. So we've gone over a lot of information on today's training. Just a reminder that all of the information found in today's training can be found in the SBHS billing guide. In addition, providers may find the ASHA website and the CPT manual website useful. That concludes the Billing for Speech Language Therapy Services school-based training. Any questions about today's training or the SBHS program may be directed to Shanna Muirhead, SBHS Program Manager, or to your district's SBHS Medicaid Coordinator. Thank you and have a great day.